Good morning, good morning, good morning, and welcome to the Great Lakes Health Radio program on Power 96.5 FM WUFO AM 1080. And if you're listening on one of the streaming services, again, welcome. This week's show is part two. So today we will begin with talking about part two about fatty liver disease. And then on the second part of our show, it will be another part two talking about women's health. All right. So it's going to be exciting. And before we start the interview, I just want to give a little overview of Kaleida of our hospitals. And our hospitals are Buffalo General Medical Center, Gates Vascular Institute, Oishei Children's Hospital, Millard Fillmore Suburban, and we also have two long-term care centers. We have High Point in Michigan, as well as DeGraff, located in North Tonawanda. We also have DeGraff services for your medical needs during the day. And we also have clinics located in Buffalo, in Amherst, in Hamburg, south of the city. So Kaleida, we're over 15,000, I believe, strong when it comes to employees. Also, I want to mention Olean General Hospital in Olean, New York, as well as Bradford, our hospital in Bradford, Pennsylvania. So I didn't want to take too much time on all the details all the health information and all of our specialty services that we provide at Kaleida, because we do for all ages, including Visiting Nursing Association. And the Visiting Nursing Association, they're available to come to your home 24 hours a day, 7 days a week. For more information about all of the services and hospitals I've mentioned, please visit our Kaleida website. And if you put in your search engine, KALEIDAHEALTH, and then press enter, everything I've mentioned will come up. Well, today, let's get moving. Fatty liver disease, part two. And our guests for today are Dr. Andrew Tellal. Good morning, Dr. Tellal. How are you?
Good morning, Francesca. Thank you very much for inviting us back on your wonderful show.
Oh, thank you. And Dr. Tellal, can you give the listeners your title?
Sure, I'm professor of medicine at the University at Buffalo and a gastroenterologist on staff at Buffalo General Medical Center.
Thank you. And also with us, we have Dr. Arpin Daria. Hello, Dr. Daria. How are you this morning?
Hi, I'm doing well. Good morning. Happy to be here.
Oh, I'm so glad you're both here. Dr. Daria, what is your title? I want to make sure that our listeners have it correctly.
I'm sorry, could you repeat that?
Your title for the listeners.
Oh, I am an MD. I am Director of Operations at the Liver Center of Western New York in University at Buffalo.
Thank you so much. Well, I know this is part two. We had part one back in June, but I just want to refresh the memory of the listeners on why this topic, fatty liver disease, is so important. So, can we just talk a little bit about fatty liver disease? And does it only attack the liver? And what is the purpose of the liver?
Sure, I'm happy to start that, and then my colleague will discuss some of the ways in which we evaluate people with liver disease. So, to answer the last question first, which is where I think we should start, what is the liver? The liver is an organ under the rib cage on the right side, right under the breast, and it is the basic one of the basic protein producing organs in the body. The proteins that the liver produces do everything from clearing toxic substances so that you don't develop thinking disturbances to factors that clot blood. Fat protein in the blood vessels keeps the fluid in the blood vessels, as we call so-called oncotic pressure. That so it prevents the fluid from leaking into extravascular spaces, such as the swelling in the feet or fluid in the belly. So now that we understand hopefully what the liver does, let's talk in a way how the liver can become damaged. And what we're talking about today is exactly what fatty liver or metabolic associated fatty liver disease. And this is associated as part of a complex of other conditions associated with heart disease, hypertension, high cholesterol, and these diseases and diabetes. And these diseases can lead to excess fat occurring in the liver as well as other visceral organs. And so it's really important that your audience realize that it's this visceral fat that collects within the organs that can affect the functioning of that organ. Different than abdominal fat, people with big bellies, let's say, where it's confined to the belly, not such a big problem. But when it gets into the organs, it can create a big problem. And so if you take visceral fat and put it in the liver, what happens is that you get inflammatory cells that are trying to control the fat, but are not very effective. And over time, many years, 20 to 30 years, it can result in what we call cirrhosis, end-stage liver disease, which is the replacement of the liver by fibrous tissue. And that fibrous tissue over time, and in certain diseases, can develop into liver cancer. And so that's basically what we're concerned about. It's this fat that accumulates in the liver that can lead ultimately to end-stage liver disease and cirrhosis.
On that note, I mean, after you went through that scenario, so it sounds like if someone were to get liver cancer, it would be much later in life, unless fatty liver disease can happen earlier, where you may develop it. I'm just trying to.
You bring up an excellent point, and there are certain diseases such as viral hepatitis B, which affects in Buffalo mostly people emigrating from other countries, students from Eastern countries, where liver cancer can occur at an earlier age. In most of the diseases that would occur in residents in Buffalo, it's going to be as you say, at a later age, when somebody's more advanced in the number of years.
Okay. Thank you. Speaking of Buffalo, what are the demographics for fatty liver disease in Western New York, and who is at greatest risk of that you've seen of having it? And yeah.
So I'll give my colleague Dr. Daria a chance to respond.
Hi, so Dr. Talal already discussed the components of metabolic syndrome, especially those with diabetes and obesity. They would be at risk for metabolic liver disease. Also, metabolic liver disease tends to affect Hispanic people and African American people, but it can also affect Caucasians as well, especially those with a sedentary lifestyle. They would also be at risk.
So, sedentary lifestyle is one of the things you want to avoid. It
Right,
sounds
exactly.
like.
In fact, diet and exercise is part of the treatment.
Okay. All right. We are going to get to that. And how is it diagnosed?
That's a fantastic question, and I can speak a little bit about that. So, at the Liver Center of Western New York, we have a machine called the FibroScan. And the FibroScan is the only non-invasive assessment of fibrosis and fat content in the liver. This examination is completely non-invasive, completely painless, and could be done in about 15 to 20 minutes. And what it measures is the fat content in the liver, as well as any fibrosis in the liver. And fibrosis is the scarring that can happen from the liver disease. Couple updates about the FibroScan that we've had this year. Originally, when the FibroScan was approved, it was those with a pacemaker were not allowed to be examined. But now we have enough data that tells us it is perfectly safe to use even if you do have a pacemaker. So that is some good news for everybody. Also, it is most accurate exam when the patient's BMI is under 40. That doesn't mean we cannot do it if your BMI is over 40. It just means that the results of the exam won't be as accurate.
And not knowing an over 40 BMI or under 40, in lay terms, what does a BMI over 40, what kind of weight are you speaking of or referring to?
A BMI over 40, you're looking at a weight over 300 pounds.
Okay. Mm-hmm.
And that can vary depending upon the person's height. So it's the height and the weight that are the important factors. So you can have somebody who's very tall who may have a much lower BMI than somebody who would be less tall, let's say. I also wanted to just give your audience, Francesca, the phone number for how they can schedule a FibroScan.
Yes, yep, go ahead. Thank you.
So the person who does them is Rick Rajman, and his phone number is 716-878-3320. 878-3320, and we can perhaps repeat that at the end of the show for those who've missed it.
Oh, absolutely, yeah, because that's important. So, but does someone have to go through their primary care physician to make an appointment with Rick?
No, they can make an appointment just by calling Rick themselves. We are using the FibroScan as a way to screen people for fatty liver disease and as an entree into care for fatty liver disease.
Mm-hmm. Okay. Thank you. Because I'm thinking if someone calls, they may have a lot of questions for him, and he may not be. I don't know if he'll be able to answer someone's questions if they just give him a call.
No, it would be if one has several questions, it would be good to discuss with your primary care physician first or another specialist what the answer to those questions, because it can be understandably quite perplexing to understand how to proceed with fatty liver disease.
Mm-hmm. And it's just so important that the more we know / our listeners know about their health, it's just good to ask to have the conversation with your with your primary care physician. So that's all part of the reason why we're having this discussion today. Can it be cured? Once it's diagnosed, can fatty liver disease be cured? And if yes, what are the prevention measures? What would someone do?
So, unfortunately, fatty liver disease is like most of the other diseases with which it's associated, namely diabetes, heart disease, hypercholesterolemia. They can be effectively managed and managed quite well, but not yet, unfortunately, not cured. So, yes, they can be treated, but not cured. In terms of the treatment of fatty liver disease, I'll pass it over to my colleague Dr. Daria in a minute. But I did want to say that we are fortunate to have two very new treatments for this disease. To answer the last question that you asked in terms of prevention, really diet, exercise, eating right, getting out and walking, or doing whatever somebody likes to do in terms of movement, avoiding highly processed foods, general health, and those measures that prevent diabetes can be very helpful in also preventing or delaying the consequences of fatty liver disease.
Okay, thank you. And Dr. Dario, you were going to add to that?
Yes, so along those lines, um, people find it most helpful when they have a nutritionist or a dietitian who can help them with their, nutritional counseling or dietary interventions. And we recommend the Mediterranean diet, especially for healthy eating and for weight loss. Along those lines, we highly recommend exercise, physical activity, and personal trainers can go a long way as well.
Yeah, and if you don't, and I'm just going to add, if you don't have, money for the gym or you don't have money for a personal trainer, there are so many exercises on online and that are free. You don't have to pay for, and you would just put in your level of activity. Is that something you would agree with? Like if you're a beginner, you haven't, or if you haven't exercised in years, um, how to get started. If somebody really wants to, get started with managing their health, um, how would a person who hasn't exercised, let's say in 15 years, where would they begin? Do you have any recommendations?
Sure, somebody can begin walking. There, especially during the warmer months of the year. There are a lot of nice walking trails, biking trails, and any movement will count. And starting slowly, trying to do a little bit, and gradually building up, I think, are very important aspects in terms of how to re-engage in exercise if somebody hasn't done so for many years.
And during the colder months, I find people walking at the mall.
Correct. Yes. And I remember years ago, one of my friends, her mother would every like half hour take a break. She would set the timer and walk around the dining room table like 15 or 20 times or something. And she was at the time she was in her 90s.
Very true. My mother, who's in her late 80s, does high intensity training on her bicycle for
Does
30
she?
seconds or a minute. So, Francesca, on this topic, I wanted to ask you a follow-up question.
Yes.
When we were on our last show, you spoke about the fruit, vegetables, or a plant that you had gotten that was growing either fruit or
Oh,
vegetables. And I was wondering maybe you could speak to that because I think that was an important point. And how did your plant do this summer?
oh my gosh, I'm so excited. Thank you for asking the question. Well, for the listeners out there who remember Gail Wells passed I believe 2024. I don't think it was 2025. I believe it was last year, and she was very much an environmentalist and always talked about the importance of plants and fresh fruit and vegetables. Well, earlier this year I went to a celebration for her life, and they asked people, did they want plants? And I said, sure, I'll take a plant. I'm not a big planter. And they said it had to be transferred. So I transferred the pot. There are two green peppers right now on the counter at work. I've shared them with my neighbor. My neighbor said they're delicious. They're sweet peppers. And I was looking at my plant just I think this morning before leaving the house. And there are several that are now coming that are growing, and it's just water, transferring the pot out, watering it every day, having a conversation with it as well, and making sure it gets sun. I never really believed people when they said that's all that was needed, and I am so excited. I don't know what I'm going to grow next year, but the thank you for asking. They're doing extremely well. At one point, I took one of them off the vine, and it became a red pepper.
Very
But
nice.
I have these. Oh, now I'm excited to maybe take the peppers and garlic and onions and do something, tossing it in. I don't know, maybe with some zucchini and mushrooms. Making a vegetarian type of dish. But thank you for asking, and I never would have believed how, and it's been a dry summer. It's just water and sun,
Hmm.
and they're growing like wild now. So thank you for asking.
Sure. Maybe in the last few minutes we could touch on medication because I think if, unfortunately, if the prevention efforts don't work, the good news is we have some new medications available now and a few others on the way. And so I'd like to turn it over to Dr. Daria to just speak about this for a minute.
Okay, so as of today, there are two medications that are approved for metabolic liver disease in the United States. The first medication is called resmetirom, and it's been out for about 1 year now, and it's to be used alongside diet and exercise for stage 2 fibrosis and stage 3 fibrosis. For those who may not know, there are 4 stages of fibrosis, and this medication is approved for stage 2 and stage 3. The common side effects are diarrhea and nausea that, if they happen, they resolve after a few weeks. The second medication is called semaglutide. And believe it or not, this medication was only approved yesterday.
Oh my goodness.
And this medication is a glucagon-like peptide 1 receptor agonist. And it is a once a week injection. And it is previously approved for obesity, but now it is approved for metabolic liver disease. And it was only released yesterday. So before we only had one treatment option, today we have two treatment options. And for those where either medication is not applicable for you, we are offering a few clinical trials at the University at Buffalo. And the phone numbers for the clinical trial is the same phone number that we gave for the FibroScan. That is 716-878-3320. And our address is at the Clinical and Translational Research Center, 875 Ellicott Street, downtown Buffalo. Again, 875 Ellicott Street, downtown Buffalo, right next to Buffalo General Medical Center.
Yes, it is. And you know what? It's also in the same building as UB Educational Opportunity Center.
It is the same building as Gates Vascular.
Oh, the same building as Gates Vascular. I'm sorry. I'm on the other side of Ellicott Street. Sorry. Yes, you are. You're correct, of course. But yeah. So it's also on the bus line, and it's on the subway line, and there is a parking lot across the street, and there is parking on the street. So it's very accessible to the public. 875 Ellicott Street. Well, we have about 4 minutes left. So again, if somebody now the medications that were just mentioned to help with I'm calling it fatty liver disease, but the medical term is metabolic um
The medical term is actually metabolic dysfunction associated steatotic liver disease, but I call it metabolic liver disease for short.
Okay, so for metabolic liver disease, and someone goes to their primary care, will the primary care specialist have this information, or would they have to educate their primary care physician about the information that we're discussing today?
Unfortunately, it may be an education process.
Okay, that's
We,
fine.
no, and Francesca, that's a very important point for your audience, for the listeners to know, because there is more and more data that are coming out about fatty liver. We're understanding it more and more. And unfortunately, because many people may not have been diagnosed early enough, we're also seeing more and more incidents of cirrhosis, end-stage liver disease. And so this is a very important point that if your doctor or your physician or healthcare provider, nurse practitioner or physician assistant aren't familiar with fatty liver disease, please feel free to educate them. Reach out. We gave you the phone number for the FibroScan, or contact us in some way, and we're happy to discuss your individual case or situation.
Mm-hmm. And then lastly, is it hereditary?
It is, and there, as we discussed in depth last time, there are some genes that have been identified primarily in the Hispanic population to date. Just because they haven't been identified doesn't mean they don't exist in other populations, but at least to date, the best work on genetic associations has been done in the Hispanic population.
Thank you. I found we have 2 minutes left. So anything we haven't discussed that you would like to mention in the last 2 minutes?
I'll let Dr. Daria finish.
Um, I would just like to give everybody the opportunity to reach out to the Liver Center of Western New York if you think you might have metabolic liver disease or any other liver disease. Our clinic phone number is 716-961-9900. Again, this is for the Liver Center of Western New York.
Thank you. And as so many of our programs focus, and we discuss all these topics, so many things lead back to non-sedentary, getting up and moving, and Mediterranean diet. It's like all roads lead back to that. So I'm just glad to hear that, because I know our listeners have been hearing that from several of our guests, regardless of what the disease is or what condition. So many roads lead back to that, and how important that is, managing your health. Physicians cannot manage your health. Only we can manage our health. And of course, physicians help. Our primary care physicians help. That's why we have the show today. It's how to help. And it's all about helping you.
And so I'll just say on that note that nobody should be embarrassed or afraid to discuss this topic with any healthcare provider. It's only by increasing awareness and increasing education that we're going to make the inroads into this problem, which unfortunately is becoming more and more more and more prevalent every day, and is now the leading cause for liver transplantation.
Thank you. Liver transplantation or transplants. And on that note, Dr. Talal, I would like to thank you. And Dr. Daria, I would like to thank you for being our guest this morning on the part 2 of fatty liver disease, which is known as, in the medical terms, as metabolic liver disease. So I've learned something this morning. So thank you both.
Thank you very much for the opportunity to speak with your audience today.
And thank you for having us.
Oh, you're welcome. Listeners, don't go anywhere. We will be back in about 30 seconds. And now on to part 2. And welcome back to the Great Lakes Health Radio program here on Power 96.5 FM and WUFO 1080 AM. Or you might be listening through one of your streaming services. Well, thank you for tuning into the second half of our show, if you're just tuning in, or thank you for continuing to listen to our program. And we hope that during the last segment there's something you can take that you were able to walk away with and share with your friends and family and acquaintances, as well as this part of the program. As I said before, the first part of our program was a part 2, and this part of our program is part 2. And our guest for today, she was with us 2 weeks ago, but we didn't finish talking about everything, is Dr. Jaleese Sosa.
Yes.
Jaleese Sosa, who is a physician, also has her MPH, that's Masters of Public Health. Dr. Sosa is a medical director at Oishei Children's Hospital and the OBGYN centers. And that's our OBGYN location at Kensington. That's located on the ECMC campus in front of the bus stop, and also at the Niagara Street location. And also Dr. Sosa is accredited and minimally invasive gynecologic surgeon. So she's also a surgeon. And there's a very small percentage of the population that are surgeons, and even a smaller percentage of African American women of color who are surgeons. And I just had to throw that in. Good morning, Dr. Sosa. How are you?
Hi, Francesca. I am doing well today. Thanks for having me.
Oh, you're welcome. Well, Dr. Sosa, last time we were talking about fibroids. So for those who were unable to listen, can we just go back and revisit that topic, because it's a topic we don't know enough about and we don't talk enough about. Women a lot of times suffer and they don't ask questions and they suffer. You can wake up one day, your body feels one way, and you wake up the next day, you're like, oh my God, what is that pain? Where is it? So I just want to make sure that we just cover fibroids just for a little bit, because we're going to be talking about menopause. Our topic for today is menopause. So fibroids, what is a fibroid? Where do they come from? And what are some of the warning signs of fibroids?
So fibroids are benign growths that happen in the uterus. The uterus is a large muscle, and some of those cells go rogue. It may be because of a mutation where the cells no longer listen to the rules of the body and they decide to grow excessively and grow into these cells that sort of have the consistency of a baseball. And over time, they can grow pretty large, even to the size of a basketball or larger. We can't identify one single source of what causes fibroids. We know there's this gene mutation in the MED12 gene, but it could also be environmental factors influenced by chemicals we call endocrine disruptors. So these are chemicals found in our makeup or perfumes, things in hair relaxers, in plastic bottles. So those things may also have an influence on that gene, causing the mutation and then leading to the growth of fibroids.
And what are the warning signs?
Yeah, the warning signs of fibroids are traditionally heavy bleeding, so heavy periods, even if it's been your normal since you started to have a period, where you're soaking more than 4 pads a day, or you're worried about leaving the house because you may bleed so much, or you have to lay down a towel on your bed at night. Those are concerning signs. If you're anemic as a result and your doctor can't find any other cause, it could be because of the heavy bleeding from fibroids. Pelvic pain, which oftentimes may present as pressure or the need to go to the bathroom very often to urinate. Those are some of the signs. Or an abdomen that just keeps growing bigger and sometimes may even look like a pregnant abdomen. That is one of the other signs, common signs of fibroids.
Mm-hmm. And I know before I said the size of a basketball, and I'm assuming if you have something growing in your inside of you and it's the size of a basketball, wouldn't it cause some pain or discomfort?
For some people it does, some people it doesn't. We'll have some folks who have normal periods, no pelvic pain. They just think, it's probably normal for me to be a little bigger in the midsection, and they have no clue until they have an exam. And that's why it's important to see a gynecologist each year so that when we do a pelvic exam, we can identify these cases where a patient may not be aware.
Yeah, that's just so amazing. treatment. I know is there treatment for fibroids and treatment meaning to remove the fibroids? And can you resume work and exercise? And what's the average length of time you can resume work and exercise?
So, as a minimally invasive gynecologic surgeon, I specialize in removing these very large fibroids through small incisions. Traditionally, women would have big C-section scars or even the up and down scar that runs from your belly button all the way down to the pelvic bone. And thankfully, now with minimally invasive surgery, we have the ability to do the surgery in a safer environment with a quicker recovery for patients. So, most patients feel really great about 2 to 3 weeks afterwards, but we still have them out of work for about 4 weeks or so for a full recovery so that they don't have any obligations at work that could slow their recovery. And this procedure is called a myomectomy, where we go in and remove the fibroid itself and retaining the uterus in place. Uterine preservation is something that's personally really important to me, but many of my patients really would love to keep their uteruses. So we're able to remove the fibroid and keep the uterus healthy. It could help women who have issues with fertility. It could help the symptoms of heavy bleeding and pain. And like I said, usually you're pretty good about 2 to 3 weeks out, but taking about 4 weeks off of work. And what else did you ask?
You know what, and that was basically it for the questions, and some really important things is to listen to your physician, and what Dr. Sosa is saying, going back to, let the physician decide when you should go back to work. And I know before I had shared with listeners that I had fibroids, and I remember I did something a little too soon, and it was stupid. So I'm just saying, just based on personal experience, don't listen to your doctor. Please listen. And Dr. Sosa, you taking new patients, and what's a phone number that they can reach you in case someone has all these symptoms? And even if your mother or grandmother, your aunt had the symptoms and you think it's just normal, it may not be. Let Dr. Sosa be the one to decide. Your number, how can people reach you?
Yeah, so I am happy to take on patients with fibroids, endometriosis, pelvic pain, heavy menstrual bleeding. And you can find me at our Niagara Street OBGYN location. Our phone number is 716-768-7700. You can call that number for an appointment, and we're at 564 Niagara Street. We're also at Kensington OBGYN. And that, like you said, is on the ECMC campus. The Kensington OBGYN number is 898-5000.
Okay. Okay. Thank you. Now, on with the topic for today, menopause. If menopause is a natural part of aging in women, and we should all embrace getting older, in your opinion, why don't enough women know about menopause, and what are some of the signs of menopause?
I think the conversation about why enough of us don't know about it is one we could have for a long time. Culturally, issues related to the female reproductive system are kept hush hush, right? We don't talk about your periods. I remember once a family member told me, not even your husband should know you're on your period. I'm not sure how that's possible.
Right, right.
But this is just cultural. We just don't talk about these things. And in a world where so much of a woman's worth may be linked to her reproductive abilities, now when you undergo menopause, menopause essentially says reproduction is over. And that, for some reason, has a negative connotation for us culturally. And that, in addition to the fact that women's health is understudied and under-researched, has contributed to that. The signs of menopause are the most common ones are hot flushes, night sweats. People may experience vulvovaginal symptoms of dryness and painful intercourse. Those are the most common ones, but you could see other things like brain fog. You could see changes in weight despite you doing your best to remain healthy and exercise. You can notice more aches and pains in your joints and your muscles. You may be at risk for osteoporosis as a result. So there are many, many changes that occur as a result of the transition that is menopause.
And something when we talk about menopause, you just talked about weight gain. Do you do you have to gain weight? I mean, if you I don't I'm just saying, if you diet and exercise, do you have to gain weight, or do you just naturally gain weight and it just stays there?
It's sort of natural, so you don't have to gain weight, but your efforts that you previously used, you may have to ramp it up a bit. So
Okay.
perhaps, whatever level of exercise you did before, however you ate before, was enough to keep you at the weight that makes you feel happy. And then you may notice that I'm doing the same things, however, my weight is creeping up. So that means you may have to do more. And what happens is that as we age, our muscle mass decreases, we lose muscle. Muscle is what burns fat. So if we lose muscle, we have less of it. We're not able to burn as much fat. And so we hold on to that fat more. So now we may have to do more exercises where we build that muscle. So we want to do strength training where we're lifting dumbbells, you're doing squats, sit-ups, things like that to help build the muscle so you could still burn the fat like you did before. And then you may have to pay a little closer attention to your diet, increasing lean and healthy protein because protein builds muscle, but you also may not have as much leeway in, having sugary stuff or a lot of processed food. You may have to be a little bit stricter now, if your goal is to maintain the weight that you're accustomed to.
Mm-hmm. Yeah, because and that's always a question. Like a lot of times women get older, they're like, "Oh, you're just going to gain weight," but it's like, well, you might be gaining weight. Well, number one, because you might be eating the same, and that could be cause part of it. But no one ever talks about menopause. I'm gaining. I
Yeah.
remember my doctor years ago made a comment about. I mean, it was years ago, and but I just thought about that. How women never even talk about weight gain because of menopause. That's like, yeah.
Yeah, and
Um,
aging. Men do it too. They just have more muscle than us, so we don't see the effects as much. But it's also just part of aging.
yes, it is. What are some treatments for menopause?
So menopause happens because our ovaries start to decrease its estrogen production, starting from about age 35 and onwards. And as we make less estrogen, there are changes that happen in our body. So essentially the most common treatment that you'd hear about is estrogen replacement, or what people traditionally called hormone replacement therapy. Now it's being called menopause hormone therapy. But our goal really is to replace the estrogen that we're no longer making. And so that could be in a pill form, it could be in a patch, it could be a vaginal ring that exists. And one of those options is usually very helpful, and most women are pretty relieved once they've started taking that because they start to feel like themselves again.
And I remember a while ago watching a movie. I've seen this movie a million times, and the woman in the movie, because they had taken her medication away, she was eating sweet potatoes. Are you familiar with sweet potatoes being good, a supplement for menopause?
I know of yams, I believe,
Yams. It
in
was
parts of
yams.
Western Africa,
Yeah.
because it has estrogen-like components. Um, the studies that were done don't reliably show across the board that menopause symptoms are relieved. I would say yams are pretty healthy.
Okay,
And
and
they're
that's what
they're
she
good.
uses in the
Yeah,
movie.
exactly. And a good healthy source of carbs. And if you personally feel like it helps you, why not?
Why not?
Yeah, I don't see any harm in having abs, to be
Hmm.
honest. But the studies don't reliably show that the estrogen-like properties are sufficient to really fully treat the symptoms of menopause.
And I have to add, and if you're eating a yam, you can pop it in the microwave you can't load it with butter and like brown sugar. That defeats
Exactly.
the point. That
And
defeats
steam it, grill
steam,
it. Yeah.
right? Yeah.
Yeah.
What can women do? So are there anything else women can do to avoid um discomfort during menopause? And what age? First of all, let me just say, what age does it begin? Does menopause begin, and around what age does it seem to drop off?
The average age of menopause is about 51, but women can have symptoms in their early 40s, into their late 50s. Everyone's different, but if you start noticing those changes, it may start around 45 or so.
Mm-hmm. And and I just thought of another question. It's popped in my head. Can you have going through menopause and get pregnant?
Yes, you can, and you are probably more likely to have twins.
Oh, really? Why?
Yeah, so as you know, when the ovaries decide to slow down its production of estrogen, it's not a straight line that sort of descends to zero. It's really erratic and really crazy. And what that could do is sometimes trigger the ovary to release multiple eggs at the same time. And if those eggs were to be fertilized, you could end up with twins. So until you have gone an entire year without a period, you're not in the safe zone when it comes to not getting pregnant again.
Oh my goodness. So and you mentioned hot flashes is something. I know something else you mentioned. Mood swings. Now, what triggers the mood swings?
Again, the estrogen, the lack of estrogen, and that big shift in estrogen changes. It is erratic. It looks like a large zigzag. It goes up, it goes down, it goes across. And that's very confusing to the receptors in the brain. And they're just trying to get the estrogen that they need, and they may get it sometimes, they may not get it other times. And as a result, you notice mood changes. But also, if you're having a lot of hot flashes, you're having night sweats, you may not be sleeping well, and lack of sleep is a big contributor to mood. And so the combo of that secondarily could also lead to mood changes in the menopause period.
Are you familiar with pillows or I don't know, sheets, and they say are cooling? I'm just
Mhm.
wondering, do they really work?
Yeah, there are certain materials that if they're cooler, they're not going to prevent you from having a hot flash per se, but it may have you help you sleep better. You may not have as many hot flashes or as severe. So yeah, those are helpful in dressing in layers that you could remove easily using your AC, your window, your fan when necessary. Those all could reduce the frequency and severity of the hot flashes.
Dressing in layers. I forgot about that.
You
Yeah.
won't forget soon enough.
Right. Um, any other tips that you have about avoiding discomfort?
I think the biggest thing is really, as we say in probably all of medicine, is having a healthy lifestyle where you have a healthy diet, close to the Mediterranean diet. You exercise about 3 to 4 times a week, including strength exercises. You try to optimize your sleep. And when you do those things, we know that women who do that consistently have less severe menopause symptoms. So it's really important to prioritize self-care and optimize your wellness so that the side effects of menopause are minimized for you.
I have to say that, interviewing guests from Kaleida, a wide range, people keep talking about this Mediterranean diet. Um, if someone hasn't looked it up yet, and it
Mhm.
was because we talked about it earlier on the show, what is a Mediterranean diet, and what are the things that to aim for? Because I think a Mediterranean diet, I think of pita. I don't know. I think of rice. I think of salad.
You're
You
right.
know,
Yeah.
baklava maybe.
Mhm.
So what are some of
Yeah.
the healthier choices for our listeners to hear about in a Mediterranean diet?
Yes, so definitely not too much baklava, though I
Okay.
do love it. So the
Right.
Mediterranean diet, I guess more appropriately, would be called a diet where you intake a lot of lean protein, you use healthy fats and oils, so that's your olive oil, avocado oil is another healthy one. You want whole grains, not white bread, not white rice, but brown rice, whole wheat, whole grain bread. You want maybe even whole grain or leguminous pasta and lots of greens and vegetables. That is essentially the Mediterranean diet. You minimize processed food, you minimize excessive sugars, you do everything in moderation, and you pay attention to portion size. You spend time savoring that meal, you're not rushing through meals. And when you spend time savoring that healthy meal, you're less likely to feel hungry, 2 hours later, you're less likely to crave something super sweet. If you want something sweet, a dried apricot may be better than candy. Banana may be better than something processed.
Then say a banana chip, because a banana chip has
Exactly.
a lot of sugar in it.
Exactly.
So,
And that is processed. So again, as close to natural as we can, incorporating lots of vegetables, lean, healthy protein, and not soaking your foods in unhealthy butters and oils. If you're using oil, it's minimum olive oil, avocado oil, preferably.
oh, okay. Now that's I have to say it's easier now to find those selections if you're going out to a restaurant on a menu than let's say 15 years ago. You
Yeah,
know,
you're right.
and at the restaurant sometimes you can things that you can say is if let's say green beans, and they're going to put butter on it because it says in there, whatever it says, ask for salad dressing on the side, ask for butter on the side. You can always ask for gravy on the side because all of those are all part of processed foods, correct? Am I correct?
You are correct.
Yeah. So, I mean, fried fish, is it good with fish fry? Yes, it is. But so is broiled fish
Exactly. Yeah. And in moderation,
in
you
moderation.
don't have
And
to eat fried fish every week. You could, once a month.
right. And even and I say broiled fish because some places also offer Cajun, but sometimes a
Hmm.
Cajun fish has a lot of salt that makes up that flavor.
Yeah.
And the salt goes into does having a diet with too much salt, I know when I think of salt I think of blood pressure, I think
Hmm.
of but does salt having a diet with a lot of salt or people who sprinkle salt on everything, does that affect menopause at all?
Yeah, you're absolutely right. Thanks for bringing that up. One of the biggest risks after menopause for women is cardiovascular disease. So,
Oh,
as we reduce our estrogen production, we're unfortunately at higher risk for heart attacks. So, salt can contribute to that because salt causes a sort of hardening of the blood vessels that supply the heart. And when those blood vessels are firmer, there's more resistance in them, leading to higher blood pressures, which means the heart now has to work harder to get blood to the necessary organs. So yeah, high salt diet can be very harmful at any point in life, but particularly so in menopause because we're already at risk for heart disease, and salt could make that even worse.
now and I know so heart disease is that like the number one killer of all women? Is that what
Yeah.
that? Yeah.
Hmm.
And I never thought about that till now.
Yeah.
Women over 40 or women over 50.
Hmm.
Um, so my friends who are listening to me, you know how I am. I'm going to be even worse now because now that I know that salt, I want us all to live long. I want all of our listeners to live long, healthy, quality of lives. So that I want for um, everybody. We have a couple of minutes left. Anything that we haven't that you would like to mention that we haven't mentioned?
I think one thing we mentioned, going back to the beginning when you asked about why we don't know enough about menopause,
Hmm.
From a gynecologist perspective, we also need to do a better job at preparing our patients. And so my message to everyone out there is that it doesn't start when the menopause symptoms start. The changes actually happen long before. So if you're 35 and above, this is the time where the things you put in place now will help you later on. So developing that healthy lifestyle where you exercise regularly, you do strength exercises, you have that healthy diet, you prioritize your sleep, you reduce your stress. Those things that you in place now will determine how well you do in your 60s and 70s. So don't think you have time. Don't think you can wait. Start now. Your future self will thank you.
Yeah, and for our listeners who might be, let's say, you're living in a multi-generational household, it's okay to encourage your children or grandchildren to eat healthy, because I don't know if studies show it or not, but I know, or not I know, I feel that if you see someone practicing healthy habits early on, it's just kind of, it's not genetic, but it's just going to become hereditary, and it's just going to be something you're used to seeing. So don't be afraid to say, hey, do you want to try some of this? Because children and young adults, people are watching, what in terms of what you're eating.
Yeah.
Yeah.
Nature and
So,
nurture, right? Nature is the genetics and nurture is what we see in our environment. And yeah, we could nurture our young ones to have a healthy lifestyle.
I like that. I like nature and nurture use like that. Your phone number one more time. We've about a minute left. One more time.
So Kensington OBGYN, 716-898-5000. And then Niagara Street OBGYN, 716-768-7700.
Thank you. And then I just want to mention that at the location at on the ECMC campus, it's in a standalone building. It's not in the major building, the main building. It's a standalone building across from where the helicopters land.
Exactly.
And there's a bus stop right in front of it. The number 13, or the bus
Yes.
stop's right in front of
Mhm.
it. But Dr. Sosa, we are out of time, but I want to thank you for, again, being our guest on the Great Lakes Health Radio program. So I
Thanks
want
for
to thank
having
you.
me.
Oh, you're welcome. And I want to thank our listeners for tuning in this week to learn and educate your friends about health. This is a Great Lakes Health Radio program. I'm your host, Francesca Messiah, Manager, Workforce Development from Kaleida Health. Next week, you'll hear my esteemed colleague, Cindy Bass from ECMC, Erie County Medical Center. And until then, I hope you wrote down a few tips on your health. This program is for our community, your community, and it's about your health. Thank you. Bye-bye.